evening, everybody. My name is Megan Jagoski. I'm one of the medical oncologists at Levine Cancer Institute. Not a huge fan of public speaking, but much rather prefer to talk to patients in the one-on-one setting in the office. But I'd be remiss to pass up the opportunity to be here tonight to express my deep gratitude for this foundation. You all have provided immense support financially for our research projects in bettering the lives of patients who have sarcoma in our community and beyond. Dr. Anderson and I have dedicated our career so far to studying this disease, to treating this disease. As you know, it's extremely rare compared to other cancer types, and therefore research is challenging in this field because of the rarity, because of how diverse this population can be of sarcoma tumors. But at Levine Cancer Institute, we're very lucky. We have expertise in pathology and radiation oncology, our radiologists, our surgeons, medical oncology, and we've treated thousands of patients with sarcoma in this community, so it's just so right for research opportunities. So we thank you for your support, because research cannot happen without financial support from our community and from our foundation, so thank you very much. But to talk about what we've done thus far, when I started as a trainee here, as a fellow, we had the trial using immunotherapy with chemotherapy to treat advanced sarcoma. It was enrolling patients, it was up and running, and since it's fully accrued and completed and been published, we have our name and support in using immunotherapy with chemotherapy in some cases of sarcoma, and it's been very effective in some types of sarcoma. And now in my own clinical practice, I can use this publication that the Politakis Foundation has helped to support and now publish, that I can get these treatments approved for our patients that I see day in and day out here. So we've actually been able to allow immunotherapy and chemotherapy to be given in the advanced setting in sarcoma, which had not been available before this trial here at Levine Cancer Institute. So that's huge, and that should be a very impactful, very evident way that you all have supported, improving therapy for our patients. So thank you for that. Current studies that we're doing right now, one is in synovial sarcoma. This is a very rare, a very aggressive type of sarcoma that impacts patients who are very young. And we are looking at cases to try and figure out why some patients have metastasis and some do not. Some cancers, when we take them out, they're gone, they never come back, and then other cases, they're able to metastasize later in life. So we are looking at what drivers, what the cancer cells are using to be able to eventually spread and metastasize. And that was the research that was supported by Politakis Foundation and recently presented by myself at the Connective Tissue Oncology Society. It's a well-renowned, world-renowned society of all sarcoma experts. And I was able to present it, very well received, very interesting, and it's sparked some hypotheses for clinical trials that we're going to develop here at Levine Cancer Institute for our patients. So it's just kind of the launching point for clinical trials that we're in development right now with protocols. So that's all because of the foundation, that supported this current research. And I know Dr. Anderson has some other research he wants to talk about.
Sure. Thank you, Megan.
Yeah.
And I would like to, extend my gratitude, sincere gratitude for everybody here and all your generous donations that have allowed us to do the work that we're doing right now. What we're doing would not be possible without your generosity. So thank you so much. In addition to the synovial sarcoma work, one of the projects that we've been working very hard on for the last number of years is trying to develop a liquid biopsy for sarcoma. So I'm a little curious, how many people in the audience have heard the term liquid biopsy? Can you give me a show of hands? Yeah, so we've got a mix of hands, but it's probably good if I try to define some of these words. So liquid biopsy is trying to understand the status of somebody's disease from a test of a bodily fluid, most commonly blood. A PSA test is a good example of a liquid biopsy that most of us are probably familiar with. Over the past 10 or 20 years, as fancy sequencing technologies have evolved, some of these technologies exist for other cancers, but we don't have that in sarcoma. Wouldn't it be nice if we had a blood test to tell us, does someone have this disease, or is their disease responding to treatment? We don't have that. And so we've been working very hard on developing a strategy to do this. And with funding from the Polytechnics Foundation, have completed our initial pilot study, which was relatively small, only looking at about 15 specimens, but we were able to detect presence of sarcoma in the blood in 70% of those. That was better than I expected, and I think with more tinkering, we could make it even stronger than that. So was thankfully able to present this at our Musculoskeletal Tumor Society meeting in Canada this year, and it was very well received. And with these preliminary data, we're going to go forward. We're going to develop a prospective clinical trial for patients that have sarcoma at our institution to understand how can this technique be implemented clinically. Can it help us understand the diagnosis better? Can it help us understand if somebody's responding to their chemotherapy or their radiation therapy? And can it help us understand if the tumor comes back? Those are all tools that we don't have. And if that could be as simple as a blood test, it would be miraculous. And I think we're positioned right now that we could really be global